World Mental Health Day on October 10th offers a chance to reflect on our psychological well-being and speak candidly about mental health. With mental health in humanitarian emergencies as the campaign theme, the 2025 edition of this day focuses on the urgent need to support the mental health and psychological needs of people affected by humanitarian emergencies. The aim is to reach those affected by crises and conflicts when support matters most.
The impact of emergencies like war and natural disasters is a massive for a population that is going through it. This includes civilians and aid workers. If we take Gaza for instance, in addition to ensuring the physical safety of our patients and staff to the greatest extent possible, aid organizations like MSF are also providing psychosocial care to them. The intensity of long exposure to these traumatic events are shattering the psychological state of Palestinian people in Gaza. This also includes healthcare workers who say they come to work not to think about war.
Wars, natural disasters, and any other humanitarian crises deeply impact both survivors and responders. According to the United Nations Office for Disaster Risk Reduction, in the year 2020 alone, more than 98 million people were impacted by disasters, with many suffering serious mental health effects.
So generally what it happens that in normal conditions, we as persons, we try to find out, through difficult situations by connecting with our near and dear ones, our relatives, our friends. But in a humanitarian crisis, the crisis happens to the large mass of population, and what it does is it suddenly takes away the social support system that we generally depend on during situations of crisis. So what we need to do here is we need to build the support system in and around that event. Number one. Number two, we need to follow the rules of triage.
Experts say mental strain is not only limited to those directly affected. Constant exposure to news items on conflict and tragedy can also cause anxiety or a sense of hopelessness. Taking breaks from media, managing what content we consume, and seeking help can make positive differences to our mental health.
You see, when you talk about such a crisis, we only think about those people who had been physically affected. It's not so. And people across different ages are affected. Young people, very young people, very elderly people who have generally very limited amount of coping and going through already different challenges, different physical health conditions. Young people are growing, the brain is growing, so it leaves a very bad impact, a very long-lasting impact, and the trauma can be it can be very very difficult to handle at times. The trauma is very huge.
Migrants, refugees, and crisis-affected people face lasting mental health challenges. Access to care, support, and community-based help are vital to heal, rebuild, and strengthen resilience. So this World Mental Health Day 2025 is highlighting the importance of reaching out to the most vulnerable.